Welcome. This video will walk you through the recommended activity restrictions after treatment. First of all, we want you staying mildly active during your treatment plan. The best form of activity during your treatment plan is walking. We do not want you sitting for long periods of time. We typically suggest walking 15 minutes out of every hour while you are awake. This should be a standard pace type of walk, which is about 3 miles per hour maximum on the treadmill. You should be able to easily carry on a conversation and not be sweating or breathing heavily. Walking helps keep the blood flowing through your healthy veins, which will decrease chances of complication. There are a few restrictions to list. We do not want you doing any heavy lifting or exercise level activities. We do not want you tightening your stomach muscles and holding your breath, which is called a Valsalva maneuver. Please refrain from deep squats like a baseball catcher's pose. If you need to get low, drop to one knee instead. Please avoid hot baths, hot tubs, hot saunas, and swimming while you're wearing your stockings, which is 2 weeks after treatment. All of these things can reopen treated veins and result in need for further treatment. We are happy to provide you with a doctor's note if you would like to pause your gym membership for the time being. If you need to pick up a child or a heavy object, be sure to breathe through the process. It helps to inhale while bending down and exhale while lifting. Again, try not to tighten your stomach muscles and hold your breath or treated veins may reopen. We love if you have a regular workout routine and we don't want you to lose that habit. We ask that if you still want to go to the gym, go through your normal motions but at a much lower intensity level. For example, pick up a 2-pound dumbbell instead of a 10-pound dumbbell and slowly do your reps while focusing on your breathing. Or instead of treating your bicycle workout like an intense strength training, think of it as a relaxed stroll. There is no true downtime after these procedures, and everyday activities and household chores may resume right away. If you have the help available, do not be afraid to ask for assistance with things such as carrying heavy laundry baskets, bringing in bags of groceries, and lifting children. Stretching, yoga, and Pilates are typically fine during your treatment plan. Just be mindful about breathing through the motions. If anything starts to feel like a workout, pull back and listen to your body. Walking your dog is usually fine as long as the dog is not constantly pulling and making you tense up to pull back on the leash. If you live on a hilly street or have lots of stairs, you may need to be more mindful about your speed. Remember, you should not be at an exercise level. You should be able to hold a conversation without being out of breath. You may return to work as normal after each procedure. If you have a heavy manual labor job, please let our staff know so we can work with you on specific restrictions and obtaining a doctor's note for light duty or FMLA. If you have a sitting job, we ask that you walk as frequently as you can. Traveling during your treatment plan is okay, but there are some added instructions. Please let our staff know if you plan on traveling during your treatment plan, as we have a few extra instructions for you. If you are flying or driving over an hour, be sure to wear your stockings and walk as much as you are able to. If you are not able to walk, do some ankle pumping for 1 minute out of every 10 minutes. Ankle pumping is a simple movement where you move your foot up and down in exaggerated motions, similar to pressing a gas pedal. Be sure that you are activating and flexing the calf muscle. This is essentially pumping blood flow back up your leg, which is helpful for reducing swelling and preventing blood clots. Finally, we will go over the activity instructions for when your treatment plan is finished. After your final treatment, you will be wearing your stockings and following all of the activity restrictions for 2 weeks as you have been your whole treatment plan. Once the 2 weeks is up, you no longer have to wear your stockings. You may wear them for longer for comfort, support, traveling, and reduction of swelling as needed. Be sure to listen to your body. We want you to slowly restart your normal activities. Limit exercise and exertion to 25% of full level for the first week, then 50% for the second week, 75% for the third week. Then try to return to full exertion the fourth week. If pain or discomfort increases, reduce your exertion for several days, then try to restart where you left off. If the new discomfort persists with activity, please call our office. Please do not hesitate to reach out with concerns. We are happy to help and answer any questions. If during normal office hours, please call the office number. If after 4 p.m. or over the weekend, please call Dr. Sabatino's after hours number. Thank you.